Congressman Kennedy, thank you so much for being here. As you heard, I am a huge fan of your book and really savor this opportunity to talk to you about some of the questions that I had when I was reading it.
Thank you. I'm very grateful for
Yes.
that. I appreciate it.
So the first question is, what would an ideal mental health system have that our current system doesn't have?
Well, an ideal mental health system would be a health system that doesn't segregate mental health, that thinks of mental health as essential to overall health. That way we wouldn't have to struggle to try to get our piece, our share, but rather the health system would be evaluating what can mental health do to improve overall well-being. And if we had that kind of health system, I would think a lot of money would shift over to mental health, because the return on investment, and speaking about big data today, we can really begin to monetize how valuable having good cognitive behavioral therapy, wraparound services, supportive housing, supportive this, all of that can literally be seen as reducing the costs and expenditures, not only in the criminal justice system, not only to the social welfare system, not only to the healthcare system, but of course to the tragic cost to families who suffer so much needlessly just because we have such a narrow view of what we think of when we think of mental health. And that keeps people from seeking mental health, when if we thought about it as the force multiplier that it is, we wouldn't be so easy to condemn it. In fact, we would be so much encouraging mental health because of what we know it could unleash in terms of potential, productivity, and overall health and well-being.
Yeah, that vision is so inspiring. Going from there, when you think about a university like ours, graduate school professional psychology at University of Denver, what's the role of a university like ours in trying to move toward that vision?
Well, first, because we've never valued mental health, we've really never paid for it, either on the clinical end or invested in it in terms of the professional development end. And unfortunately, there is a dearth of adequate training universities that are turning out the next generation of professionals who are going to take up the mantle and help us address this public health crisis. We're never going to get our arms around the crisis that we're facing as a nation unless we have enough people out there willing to practice and help us turn the tide. And we're never going to get that unless we have more universities expanding the knowledge base of what works and how to apply that in the most meaningful way. So your university, the work that you're doing is so crucial to the overall mission. There are not enough schools, professional psychology, teaching the whole spectrum of various modalities of how to treat mental illnesses, and we need more of you.
Yeah, that's great to hear.
No, and I was proud in Congress to support a couple of pieces of legislation that would move specifically child and adolescent mental health up the list of high need categories that could be subject for loan dismissal.
The loan forgiveness.
Forgiveness. So those are the kind of policies we need to pursue.
Yeah, wonderful. Well, you've already talked about the mental health stigma, and of course in your book you do such a fantastic job just talking about your own personal journey in a really humane and helpful way. What were your biggest surprises in kind of facing mental health stigma, and what advice do you have for people facing that themselves?
I never cease to be amazed at how even my judgmentalness gets in the way of reaching out to people who need help, even though I'd like to think of myself as someone that's, compassionate and open-minded, and it's essential to my own well-being that I reach out and help my fellows. But it just reminds me how deep this is in all of us, this bias and prejudice against those who behave and act in a way that startles us, that unnerves us, that makes us feel uncomfortable, and makes us step away in fear. And at least I'm aware of that feeling now, and I consciously have to fight my own inclinations and step towards that person as opposed to away from them. And then I remember that was me, and I can remember the reactions that people had towards me, and I remember them now even more clearly when I confront others that were just like I was. And it is really something. It's a tough job. I think we need a spiritual revolution, because what I think this is really about is not understanding mental health. I think we all get it on some level, but it's really addressing that fear-based response that is so much a part of our beings just in general these days. And if we were to tackle that, and that applies to race, to gender, to a whole host of things, in addition to mental health, if we were to tackle that, we'd be tackling the mental health problem, because it's just a fear response. It's a default mode that we're often unaware of. That's what we really need to try to tackle.
Yeah, and that's the humanity I was referring to that you tap into so well. Yeah, I can't wait for my students to get to hear you tonight.
You're kind.
It's going to be great.